Hello, everybody, and welcome to It's 420 Wyoming. I am your host, Red Hawk, and I'm here with my friend Bennett. How's it going, Bennett?
It's going all right.
All right, well, we got a lot to go through today, so I'm just going to dive right in. Re-regulating cannabis. On Thursday, April 23rd, 2026, the Justice Department placed FDA-approved marijuana products and products containing marijuana subject to qualifying state-issued license in Schedule 3. The DOJ states, strengthening medical research while maintaining strict federal controls. So what do you think about that? Strengthening medical research.
Well, yeah. So there's actually a lot of research coming out already. In fact, it's dozens of papers being published daily. If you get on PubMed and do a search, and you look for the latest published papers, man, it's daily. So we're getting a lot of research done already. This is going to help, and really one of the biggest ways that this is going to help is that current studies approved by the feds are only conducted with products that are produced by their producers. So it's not products that anybody is using. It's from what I hear, it's awful quality flower, and it's not the stuff that's on the market today in any of the legal states. So what this current action by the Justice Department is going to do will include the approval to use the products that are being used in states for research. So not only are we going to be able to see research done with higher quality products, but we're going to be seeing, what people are actually using. The stuff that's available on the shelves in all the legal states, that they'll be able to use those products to do their studies. So these studies that we're seeing coming out every day are going to be more reflective of what people are actually consuming, and that's really a big thing. So as far as the research goes in that regard, yeah, that's going to be a big benefit. And then, yeah, as far as controls, yeah, in a Schedule 3, the only producers of Schedule 3 products are licensed pharmaceutical companies. So they've set up a regulatory, I don't know if it's even a framework yet, but at least they've proposed that what they're going to do is take already state licensed producers and license them federally. Now we're going to have to see how that goes. It's really sort of a strange hodgepodge that it's going to just have to get worked out over time. But the idea is that they will be taking in these state-approved, licensed medical producers. And again, we're talking only about medical. They haven't done anything with any of the adult use producers or any of that market. So that's going to be a really sort of strange gray area, because these adult use shops that anybody 21 and older can go into, they are still selling Schedule 1 narcotics as far as the feds are concerned. But they're moving the medical side into federal acceptance. So it's still not an FDA approved supplement or drug or anything like that. It's just that they're saying it's kind of like a wink wink nudge nudge, we're accepting this anyway, now sign up and get licensed with the feds. And that's another step that we'll see how that plays out. We'll see what the the buy-in is from the industry. If the fees and the rigmarole that you have to go through is just onerous, I can see producers in states being like, well, why? I don't have to do this. I've been operating just fine on the state level for years. I'm just going to keep doing that and not pay the feds and not jump through the hoops. So we'll see how that goes, but they have set up a way for state legal producers on the medical side to register with the feds.
Okay. Yeah, very well explained. So, what exactly is Schedule 3?
So
Well, it
Schedule
has
3, go ahead.
Well, I was just going to read the slide here. It says that it has a moderate potential for abuse, dependence, and it also has acceptable medical qualities, and it requires a doctor's prescription.
Yes. And I've found so I have had a prescription in the past for a Schedule 3, and most doctors won't even touch them. Like there's only I only know of one doctor in the entire state of Wyoming that was doing what I was being treated with, and it's because it's a Schedule 3, and so it is accepted. You can get licensed doctors to prescribe them, but they're they're so tightly controlled that most doctors are wary enough that they won't prescribe them. So, I don't know anybody who has a codeine prescription per se.
Mm-hmm.
So,
Yep. And another one of the examples is Tylenol and ketamine, steroids, and testosterone.
well,
So
the Tylenol, it's Tylenol with codeine. It's specifically
Tylenol
the
with codeine.
codeine. Yeah,
Yeah.
the codeine is the Schedule 3 part of it. The acetaminophen is not on the schedule.
Yeah, right. Thank you. Okay, so FDA approved drug products containing cannabis. So they have the Epidiolex, which they use to treat seizures. And that one is actually derived directly from the cannabis plant. And Marinol and Syndros, those are synthetic. And also Cement, that's a synthetic.
Mhm. Yep,
And
and I see this as being where the push is likely to go, at least on the medical side, with only pharmacies being able to sell it. As far as a Schedule 3, they're trying to work around that with the licensing, but as far as Schedule 3 drugs are concerned, being produced only by pharmaceutical companies and sold in pharmacies, that will give pharmaceutical companies the ability to now take what is being listed as a medical use and turn those botanical chemicals into single isolate patentable drugs, just like you've listed here. See that, like, the Marinol is just THC. The Sativex, I think, is another one that's like 50-50 THC and CBD, and they can patent those, and then they can sell them and they can control them. So I think we're going to see at least a good segment of the medical side going in that direction because of the interest in the market by these big companies.
mm-hmm. And it takes approximately 10 years for a new medication to complete FDA approval, and only about 10% successfully reach the market. I think that's very interesting. 10 years is a long time.
Yeah. A seed will grow a lot faster.
All right, let's talk money. Now, administration fees are paid directly to the FDA. And research and development expenses are required to prove safety and efficacy.
Yeah, and we'll have to see how this works into the cannabis market. If companies are having to pay just, obscene fees that only pharmaceutical companies can pay, then they're not going to be accepted in the federal database. Then if they have to pay for research to show that their products are safe, again, you're talking about years and so much money that it it will basically squash any small industry. But because they're doing these sort of workarounds, it's possible that they're not going to require those same levels of scrutiny that they do apply to FDA drugs, but we'll see.
All right. And administrative FDA user fees. So they have a couple of fees here. Applications requiring clinical data is about $4.6 million. And, applications not requiring clinical data is $2.3 million. And the annual program fee is about $500,000.
Right. And those application fees, that's just to apply. That doesn't mean you're going to be granted anything. That means you got to come up with this amount of money for them to consider you.
And that's a lot of money.
Oh, man.
Money.
I don't know a single producer in the state of Montana here who would, pony that up for a single product. Even the largest company that's statewide. If you're talking about that amount of money for each product, I don't see them ever doing it.
Yeah. All right. Research and development costs. So they have clinical trials for a drug like Epidiolex, which requires 4 phase 3 trials. Costs approximately $19 million. And the full development cycle is a lot more. And it ranges from about $985 million to $2.8 billion. $2.8 billion.
Right.
That is a lot of money.
Right.
And they can repurpose synthetic drugs for products like Marinol or synthetic variants, and that costs between $10 million and $40 million. These drugs cost a lot of money.
Yeah.
And they shouldn't.
That's why only the big companies are in the game.
It should be a lot cheaper, in my opinion.
Yeah, I definitely prefer herbs.
So, products containing cannabis are subject to qualifying state-issued license. So, state-registered medical cannabis patients now have federal rights that will reach across housing, employment, healthcare, veterans care, federally subsidized housing, and federal workplaces and more.
Mhm.
So, for compliant, capitalized, and state licensed businesses, so they can get that potential 280E relief, and they can finally deduct rent, payroll, and standard expenses.
Mhm.
So that'll be good.
Yes, it's about time that's been legitimized. They need to open up the banking system, and that should follow as well.
Mm-hmm. And it could improve cash flow, tax efficiency, and overall financial health, which I think those are good things.
Yeah, yeah, it's very needed by the industry. I mean, it's silly to have this multi-billion-dollar a year industry cash only. I mean, that it's just silly.
Mm-hmm. The feds are now the middlemen. The order explicitly states federal regulators will incorporate state licensing into a federal registration framework. And, that means growers must have a state license plus DEA registration.
Yep.
And, the previous supply chain was simply the producer gave to the distributor and the retailer. And now they're going to have the state license and DEA registration.
Yep.
And the retailer is going to have also a state medical license, obviously.
Mm-hmm.
But these things are just now developing. And, things could change around. So this is just what they say is going to happen right now.
Right. Based on how they handle other drugs. Yeah.
Yeah. And so the federal government becomes a required checkpoint between every transfer. And interstate commerce now runs through the DEA's permission. So now interstate cannabis is allowed only if federally registered.
Right. Yeah. And we'll have to see if they choose to go more hands off, then that would be great. But yeah, if they're stepping in at every, break between the individual entities, it's going to be just messy, I guess, is about the easiest way to say it. I mean, currently with the state licenses or licensees having the government pop in and do checks and everything, like that is still something that they have to deal with and plan for regularly, and then adding a whole nother government level of scrutiny to that it's unnecessary for one thing, but it is a serious pain for the people trying to manage all of this, who are, there aren't that great of margins as it is, and so you're talking about thinning that down even further. And really, what that does is it doesn't cut the market down, but it thins the producers down to those who can produce the most and make the most money. So it's not ideal, but we'll have to see how it works out. If they do sort of just back away and say, okay, we accept the states are doing it the way, like, say, they handle alcohol and tobacco, and they'll just give us our information and our cut or whatever, then that will be much easier, and it will basically just be business as usual. But if they get heavy-handed, yeah, this could be a nightmare for years until it gets, straightened out.
Yeah, I agree. So, potential outcomes and what it does not do. We will see the cannabis company consolidation. Larger companies will absorb the tax relief and reinvest. So, it does not legalize cannabis. It does not deschedule cannabis. Adult use is still stuck. Zero movement on criminal justice reform. Adult use operators could get future tax treatment, and they could see capital access and could see banking conditions.
Could.
And get ready for a segmented cannabis industry.
Yeah, it's nice having vertically integrated companies where, from seed to sale, it's all under one roof. And yeah, if the feds want to get in the middle of everything, that's going to be harder and harder.
Yeah. All right. That's it. The FDA approved cannabis products and state licensed medical products moved to Schedule 3. That's it for now. Administrative hearings start June 29th, 2026. So stay tuned.
Yeah, and actually that's a really good point. So the the movement through the Justice Department started back with Biden, and they have been delaying it in court and everything, but it's been working its way through. And so what they will be talking about this summer will be actually moving cannabis as a whole from Schedule 1. And that will be a whole lot better. I mean, I it's not significantly better if the entire plant gets categorized under Schedule 3, but it's still a step. But they could also choose to deschedule non-medical cannabis, and they have to deal with hemp as well. So there's a lot they're going to talk about this summer, and it'll be really interesting to see what comes out of it. And I'm also really excited about the fact that they're moving the medical side to Schedule 3 will allow the VA to make the recommendations and have the conversations with veterans. And man, they've needed that for so long, because even in state legal areas, the VA can't talk about it because they fall under the federal jurisdiction. So now that it's accepted that it has medical utility, they can talk about it, they can recommend it, and so that's going to be better for our veterans, and I'm really happy about that.
I'm happy about that too. Well, thank you, Bennett, for coming on the show today and, lending your expertise. I always appreciate it.
Good to be here.
Yeah, stay tuned, folks. We'll have more videos coming out as things unfold. Red Hawk out.